Hello everyone. Today we have the discussion on the topic generic medicine and the branded company medicine. The title of the today discussion is about the branded company and the generic medicines. This is applicable mostly to the pharmaceutical field of the science. So let us have some discussion and observation on the same title. It has been found, or it has been observed, that most of the people do take the medicines and recognizes it with respect to its color and the appearance, and it is fixed in their mind psychologically that these colored medicines are made for some specific kind of cure or treatment that is known by them, for which they are aware. And generally it is also observed that most of the people believe and take the medicine on the basis of their brand name only, which are the medicines sold by the pharmacist or the chemist at the medical stores. There is an issue and the challenges with respect to the use of generic medicine and the branded company medicine. As generic medicines represent the name of the chemical formula, chemical constituent, chemical entities, chemical species, chemical substance by which the medicine is made up of, whereas the branded medicines are having some specific name as given by the manufacturer of the companies. And it is also observed that both the medicines may be manufactured by the same pharmaceutical industries. In terms of the active ingredients, if we will talk about these two kinds of medicines, so generic medications are identical to their brand name counterparts. However, inactive substances can differ. They may have the different quantity of an inactive substance. They may differ with each other with respect to the inactive substances, though these substances are not required for the cure of that cure or the treatment of that specific kind of an disease. And these inactive substances are having no any kind of an effect on the chemical reactivity of an drugs, of an medicine, of an active substance, and this has been added during the production or the synthesis or the preparation of the medicines, drugs, for the stability, maybe for the stability purpose, and maybe for the preservations of the drugs of the medicines. And it is also added in order to get the specific consistency, specific consistency, forms, color, or the taste. The Food and Drug Administration approves generic pharmaceuticals after testing, and it demonstrates their safety, purity, and the effectiveness also. It signifies that a generic and a brand name medicines are interchangeable. It has been found that there is no any kind of an evidence which indicates that brand name pharmaceuticals are superior to the generic drugs. Most of the people, if they got some simple kind of an infection like cold, cough, fever, running nose, stomach ache, loose motion, and the headache, then also they are taking the medicine with complete negligence of how dangerous, how harmful, and how deadly this all above mentioned disease can become. If negligence and the careless attitude is there towards the consumption of a medicine or the antibiotics which are required for curing this kind of an infection, maybe with respect to an unawareness regarding the chemical formula or the chemical component of the medicines. In that cases, it has been observed that the people remember and recognize the medicine from the color, appearance, size, whether it is available in the liquid form or it is available in the solid form or in the form of a capsule or any other form, maybe chewable, etc. And effectiveness of these medicines for the treatment of which kind of above mentioned common and curable infection. So in such cases, the people do take the medicine from their brand name and they remember it also. We'll take an example of one medicine such as paracetamol, which is marketed as in Calpol with the brand name. So the psychology of the people are such that if we'll take the Calpol, then only we will get relaxed or relaxation or the relief of the pain and the fever. And if the company manufacture or synthesize the specific branded name medicine by adding some more chemical constituent along with the previous formula for early and the fast relief of the pain and fever and for the fast action, even though it is not understood by the people and they do same practice. Therefore, the issues with respect to the generic medicine against the branded medicine is nowadays and slowly getting and try to get resolved as there is an increase in the awareness with respect to the pharmaceutical and medicinal education and psychology, and the mindset of the users are also gradually trying to be changed. As the pharmaceutical education became common, the people becoming aware about the use and the application of specific medicine. So I will end my talk here, and I would like to thank all for patient listening. Thanking you all.